I'm about to measure my eye pressure right now. Got it. And this is so important that we actually do this on every comprehensive routine eye exam, whether it's through the classic air puff test, the eye care tonometer, or the Goldman applanation tonometer. And we're screening and monitoring for an eye disease called glaucoma. Now, the question that I get all the time is, if my eye pressure is high, does that automatically mean I have glaucoma? No. If my eye pressure is low, does that mean I don't have glaucoma? Well, no. If you actually have high eye pressure, it can be categorized as something called ocular hypertension. So what is the difference between that and glaucoma, and why do we even measure eye pressure in the first place? Let's focus in. Now first, the definition of glaucoma. Glaucoma is an eye condition that causes damage to the optic nerve. The optic nerve, this is where all of the nerves form into a bundle in the back of the eye and head back to the brain for processing and vision. Now, if you get damage to the optic nerve, those nerves will die, eventually cause little blind spots, blind areas, peripheral vision loss, can lead to tunnel vision, and eventually blindness. Now, if you noticed, I didn't mention anything about high eye pressure, but optic nerve damage is oftentimes related or associated with having high eye pressure. But at the same time, you can also have glaucoma and have normal eye pressure. This is called normal tension glaucoma or low tension glaucoma. Now, when I say normal eye pressure, usually we're throwing at a range between 10 and 21. This is measured in millimeters of mercury. In all of these ranges, whether you're normal or you're going over 21 millimeters of mercury, we usually look for any type of optic nerve damage that could be happening. If we don't see any optic nerve damage and you have a pressure that's over 21, you might be someone with ocular hypertension, where they have considered high eye pressure but no optic nerve damage. And that really is the difference. Ocular hypertension, high eye pressure, no nerve damage. Glaucoma, nerve damage, whether you have high eye pressure or normal pressure. So in the front of the eye, there is a fluid called aqueous humor, and it actually has a natural flow to it. It gets produced into the eye and flows or drains out of the eye. And if one of these is disrupted, either it's producing too much or it can't drain very well, then it can cause the eye pressure to measure high. The question is this high eye pressure causing damage to the optic nerve? So this is why we measure eye pressure. If someone does happen to have pressure that's higher than normal, it might send off a red flag saying, hey, we need to investigate this further. Whether we're looking at the optic nerve, we're taking pictures of the optic nerve to see if there's any changes from the last time, if we're measuring the thickness of the nerve with a test called an OCT to see if the nerves are getting thin. We could be doing a visual field test to test peripheral vision to see if there's any blind spots that might be showing up. And if there is evidence that there is optic nerve damage, then we want to treat the glaucoma, whether we're using eye drops to lower the pressure or surgery. And so we use that eye pressure to know if we're treating glaucoma effectively, if we're lowering the eye pressure enough from what it was to hopefully slowing down the damage to the optic nerve. We're slowing the progression of glaucoma. Now, if you happen to have high eye pressure, ocular hypertension, we may still do the optic nerve head testing to make sure there's not any damage. And if there's not any evidence of damage, then you're considered to having ocular hypertension, or maybe we'll say you are a glaucoma suspect. You're suspicious of developing glaucoma maybe in the future. And so we kind of keep monitoring, keep watching, keep checking the pressure to see if it trends high, and obviously keep checking the nerve to see if any damage shows up. Okay, there are a few things I wanted to jump here and say as I was reviewing the video. Sometimes when we're measuring eye pressure, sometimes we get a false high measurement, meaning we might measure that pressure to be high, but in real life, that person doesn't have high eye pressure. And there can be a few reasons for this, but some examples might be the type of test or measurement or device that we use to measure the eye pressure. For example, if someone comes in and they get the air puff test, the non-contact tonometer, because of the type of test, a lot of times people are anxious. Maybe they're gonna squeeze their eyelids just because they're anticipating that air puff, and sometimes that pressure on the eye can cause the eye pressure to go high as we're doing the test. But in normal eye pressure, it doesn't measure that high. And then maybe that same person will go and use the eye care tonometer and their eye pressure will read lower. So it can depend on the test or the type of test we use. Another possible reason is corneal thickness. So the cornea is the front dome of the eye, and this is actually where we measure eye pressure. With the air puff, we're actually shooting air at the cornea and seeing how that air will rebound back. Or with the eye care tonometer, it's a rebound tonometer, so it actually shoots a probe at the cornea and see how aggressively or fast that probe shoots back. So in someone that has a thicker than average cornea or a different corneal structure, sometimes that can cause a false high measurement. But in real life, their real eye pressure is not as high as what we measured them to be. And this is kind of a common thing that we'll look for sometimes when we get a high pressure measurement, but there really aren't any other signs of glaucoma that we're seeing. Sometimes we'll do a pachymetry. This is a measurement that will actually measure the thickness of the cornea, and if it does run thicker than average, then we kind of take that into consideration of the whole global picture when we're kind of screening for glaucoma. And there's a question that sometimes I'll get a lot, and that's if the pressure is really, really high, but there really are no signs of glaucoma, there's no optic nerve damage, is there a point where it gets so high that sometimes you'll treat to lower the eye pressure just to be safe? And yeah, that actually does happen. And there may be a bunch of different things to take into consideration if a doctor is going to decide whether to start treatment, to start eye drops to lower that eye pressure. And this can be age, race, if there's any family history of glaucoma, if they have any other certain diseases or medications that might be or put them more at risk of developing glaucoma. So yeah, in some cases, a doctor might just say, hey, you know what? Let's just be preventative about this, start you on an eye drop, keep your pressures low, just because we're gonna play it on the safe side. We're gonna try and hopefully prevent or slow down or keep any damage to the optic nerve from happening. Now, glaucoma is oftenly referred to as the silent thief of sight because, like I said, there really aren't any symptoms. A lot of times you don't even know that you have high eye pressure, that your nerve is being damaged. So it's really important to go in for your eye exams, get your eye pressure checked, have them check your nerve for any damage. That's the big thing that you can do. If you want to learn more about glaucoma, you can check out my playlist right there. And if you have any questions, leave them in the comments. I'll try and answer them the best I can. Stay focused.